I'm Dr. Holmes.
Hi, Dr. Holmes.
So I hear that you haven't been feeling lately. What exactly has been going on?
I've really been having some shortness of breath and a lot of like phlegm and mucus production. Just not good.
Okay, well, I'm really sorry to hear that you haven't been feeling well. And as you know, we ran a few tests and I actually got the results back on that. And it looks like you have something called COPD, or it's also called chronic obstructive pulmonary disease.
What is chronic obstructive pulmonary disease?
Well, what COPD is, it's a progressive disease, or in other words, it's a disease that gets worse over time. And it makes it very difficult to breathe, as you've probably experienced. And two major factors of COPD are chronic bronchitis and emphysema. And chronic bronchitis affects the lining of the airways, specifically causing them to become inflamed or producing more phlegm than usual. And then with emphysema, that affects the air sacs, or the alveoli of your lungs. And it can destroy the walls of the air sacs. And all of these things can lead to symptoms that you've been having and can make life very difficult for a person with COPD.
Is there a cure?
Unfortunately, there is no cure. So over time, breathing will become more and more difficult for you, and smaller tasks will cause shortness of breath. So, for example, right now, you're probably experiencing more shortness of breath when you do extreme exercises or walk too far. But as the disease progresses, you'll experience shortness of breath just from dressing and undressing. But there are definitely treatments and lifestyle changes that you can make to help you feel better and stay more active and slow the progression of the disease.
So since I'm a smoker, is smoking something that I can change to slow the progression?
That would be a great change to make. Cigarette smoking is actually the leading cause of COPD, and by quitting smoking, you can greatly reduce the symptoms and the progression of the disease. And some other lifestyle changes that you can make would be to avoid secondhand smoke, any places with dust or toxic substances or fumes, because all those things will exacerbate your symptoms and just make it harder for you to breathe in general.
Are there any other things I can do to decrease the progression or the symptoms?
Yes, actually. In particular, using a bronchodilator. So what this will do, it will relax the bronchial muscles around the airway, and will make the airway, and by doing that, the airway will become larger and obviously will allow more air to pass through. And that will greatly reduce the breathlessness, your cough, and the phlegm that you've been experiencing. So this bronchodilator administers your medication through a spray or a mist. And the advantage of having a spray or a mist is that it goes directly to your bronchial muscles. And will allow the medication to begin working sooner. So also these will have fewer side effects than, for example, a pill would have. So now I'll just show you how to use this real quick. And the first step will be to shake the inhaler, like this. And then you'll begin to breathe in slowly. And as you're breathing in, you'll put the bronchodilator up to your mouth and press down once. This will administer the spray into your mouth. And you continue to breathe in for as long as possible. And then once you've done that, you hold your breath for 10 seconds, or as long as you possibly can. And the advantage of keeping your breath held in is allowing the medicine to reach deep into your lungs, and obviously this will give it the greatest effect and will immensely help in reducing your symptoms. So, do you have any questions?
I think you explained that very well, Dr. Holmes. Thank you very much.
Of course, and we're going to make sure that you have the best care possible so you can live a happy, symptom-free life.